Now, care home residents in England are now allowed one regular visitor in this first easing of lockdown, so they're allowed to meet indoors and hold hands, but visitors must wear PPE and they have to be tested beforehand. But for care homes for people who have more complex needs, it's not as easy as just allowing one regular visitor. There's more to think about. Well, Paul du Savary is the Managing Director of the Old Vicarage Care Home in Stallingborough, near Grimsby. Paul, hello, good evening.
Yes, hello, Andy. Nice to talk to you again.
And you, yes, tell us a bit about the Old Vicarage then and who you care for there.
Yes, Andy. The Old Vicarage is for specialist care. It's particularly for individuals who have autism, learning disabilities, and health and mental health needs. So it's quite a mixed bag, but it's each one of these individuals is complex in different ways. The current protocol around visiting has been very much considered around elder care, which is really where the challenge is for us.
I mentioned that things are slightly more complicated for you then. So what do you now have to do? Has anything changed? What are the current rules for you?
Well, I mean, essentially, we all want families to be able, within the sort of protocols, etc., to meet up with individuals. But for example, in elder care, whereas you could invite the family or the member of the family into the home, and they could sit opposite their loved one through a screen or whatever, you can't do that when you've got individuals with autism who can't handle the idea of a screen and so on. So for us, it doesn't work. So what we're doing is we're doing two things. We're facilitating the visits externally, outside, with PPE, etc., and doing it that way. And internal visits, we're doing those via what we call the Social Care Exchange, which is our resource centre. And there we have training rooms, we have breakout rooms, and we're very well organised where we can carry out tests. And equally, we can sort of allocate a room and we can put infection control in to sort of clean the room, etc., in between visits. So in a very structured and organised way, we have found a way that will allow this to happen. But it doesn't look anything like an elder care type sort of visit. It's because it's two different sort of client groups altogether.
I know it's been tough for you this past year, and I know you had issues at one point, I think, in terms of staffing and so on. How are things for you at the moment?
Well, I have to say, sunny uplands and all of that, I think that it's looking very good. I mean, typically, at one stage you're alluding, I think, to the Old Vicarage, which was very badly hit by COVID, and sadly, one of the residents did, unfortunately, very sadly pass away. But we had a situation where we were right down on our staffing, and it required a lot of ingenuity and our technology to actually keep the home running throughout all of that, and not to lose the familiarity of staff with individuals, because you can't get away from this when you're supporting individuals with complex needs. It's all about their relationship with staff and staff's relationship with them. So that's what makes it a very different scenario. But I'm very pleased to say that we have over 400 staff. And we're pushing, I think, over 350 of those staff have been vaccinated. And of the 87 individuals we support, we're approaching 80 have been vaccinated. There's a lot of really good stuff happening. But I was just listening to your figures just earlier on before this interview. And, we none of us can relax. That's the point. So it's about keeping everybody going, keeping morale up and saying, yeah, but there is no unlocking yet.